Welcome to the Increasing Language Access in Oregon Learning Module Series. This Learning Module Series presents content from a resource called Increasing Language Access in Oregon, a workbook for providers, which is a plain language, actionable workbook focused on meeting language needs in healthcare settings. There are a total of 7 modules in the series, all of which are intended to be alternative format materials to the different chapters and appendices of the workbook. All recorded modules are available on the OHA Transformation Center website. This module focuses on Chapter 3 of the workbook, Steps and Best Practices for Providing Interpreter Services. Chapter 3 outlines step-by-step guidance for providing interpreter services, covering everything from identifying when interpretation is needed to ensuring documentation is complete. It also introduces the concept of good faith effort. This chapter describes how to identify a patient's language needs, schedule credentialed interpreters, and document the services provided. It addresses common barriers, such as interpreter shortages or scheduling delays, and suggests strategies to manage them. The chapter defines good faith effort and explains how documenting attempts to secure a credentialed interpreter supports compliance and accountability. To provide equitable and effective care, providers should follow a consistent process when arranging interpreter services. First, identify and regularly assess the need for interpreter services. Ask patients their preferred language during intake and record it in the medical record. Be sure to reconfirm those preferences at future visits, as language needs can change. Next, check for available staff. This means determining whether an in-language provider with documented language proficiency or credentialed bilingual staff member is available to meet patients' needs. If no in-language provider or credentialed bilingual staff is available, schedule a credentialed interpreter. Prioritize interpreters included in Oregon's Healthcare Interpreter Central Registry whenever possible. For other cases, work with a language service company that can help identify and schedule a credentialed interpreter. Proper documentation is important. Make sure interpreter details, such as the interpreter's name, registry number, and language interpreted, are documented in the record. If you bill the Oregon Health Authority for open card or fee-for-service members, you are required to include additional visit details as outlined in the Oregon Administrative Rule OAR 410-120-00013, Sections A to E. Providers working with coordinated care organizations may also need to document additional details to meet the Meaningful Language Access measure. Schedule interpreters in advance whenever possible. This is especially important for less commonly spoken languages where interpreter availability may be limited. For ongoing services, confirm whether patient preferences or interpreter availability have changed. Ensure access during the visit. Whenever possible, position the interpreter so that the patient and provider can communicate directly. For remote interpretation, test video or phone technology before the session begins. Finally, have clear policies and procedures for providing language access services. This includes knowing when to use credentialed interpreters or in-language providers, and ensuring these resources are accessible across your organization. Together, these steps create a strong foundation for providing interpreter services that meet patient needs and compliance standards. Sometimes, despite your best planning, a credentialed interpreter may not be available. When this happens, Oregon law requires providers to demonstrate a good faith effort, that is, to show a reasonable attempt was made to schedule a credentialed interpreter before using another option. A good faith effort is documented by recording your unsuccessful attempts to schedule a credentialed interpreter. If you scheduled a non-credential interpreter, document their name, language interpreted, and interpretation modality, such as on-site, phone, or video. The purpose of documenting good faith effort is threefold. It demonstrates compliance with Oregon law, highlights interpreter shortages and capacity needs, and builds transparency and accountability with patients and oversight bodies. We purposefully do not define how many attempts count for a good faith effort because this can vary based on language, modality, and care setting. Providers should have internal language access policies that show how your organization makes reasonable attempts to schedule a credentialed interpreter before working with a non-credentialed interpreter. Let's look at what good faith effort documentation should include. Providers should record attempts to schedule a credentialed interpreter, document if they worked with a non-credentialed interpreter, and if so, document the interpreter's name, language interpreted, and the interpretation modality, such as on-site, video, or phone. Train staff to include good faith effort documentation in their electronic health record or scheduling systems. Documenting your efforts to work with a credentialed interpreter ensures your organization remains in compliance while continuing to meet patient communication needs. Now that we've discussed good faith effort, let's turn to a few best practices. Investing in interpreter staff strengthens your organization's overall capacity and builds trust among patients who feel more comfortable working with familiar interpreters. Here are some ways to expand your interpreter workforce. Support bilingual staff in becoming credentialed interpreters. Hire dedicated interpreter positions or roles that coordinate language access, such as language access coordinators. Offer pay differentials or incentives for credentialed staff. These steps not only expand your language access capacity, but also promote staff retention and patient continuity of care. Establishing clear scheduling systems is another key best practice. Streamlined scheduling helps improve interpreter coverage and ensures consistent communication for all patients. Some practices include flagging interpreter needs early during intake or scheduling, using color-coded or language-specific scheduling systems, assigning the same interpreter for recurring visits to improve continuity, keeping a preferred interpreter list with registry numbers and contact details. These strategies help ensure interpreters are available when needed, especially for languages in high demand. Administrative burden can often limit the effectiveness of language access programs. To simplify and align administrative processes, consider recording interpreter name, central registry number, and language interpreted in a consistent format. Creating quick reference workflow checklists to guide staff through scheduling and reporting. Using EHR templates to streamline documentation. Training staff regularly on how to document interpreter services accurately. These strategies help reduce staff workload and make it easier to meet compliance and reporting requirements. Remote interpretation has become a vital tool for expanding language access, especially in rural or resource-limited settings. To support high-quality remote interpretation, equip exam rooms with speakerphones, tablets, or other reliable devices. Keep backup devices or rolling carts available for busy clinical areas. Test video and audio connections before each appointment. Train staff on troubleshooting common issues quickly. Investing in these supports helps ensure smooth, reliable interpretation for both patients and providers. Some patients may be hesitant to use interpreters due to privacy concerns, or because they prefer family members or bilingual staff they already know. Addressing these concerns directly helps build trust and ensures patients feel comfortable working with professional interpreter services. There are a few key approaches that can help. Explain confidentiality and ethics. Let patients know that credentialed interpreters are bound by confidentiality and ethics codes, so their information will remain private. Clarify the risks of using family or friends. Help patients understand that while family members may mean well, they might not accurately interpret medical information or could leave out sensitive details. Work with traditional healthcare workers or community partners to address cultural sensitivities or personal concerns about interpretation. Check in regularly with patients to confirm whether their language needs or preferences have changed. These conversations can go a long way toward ensuring patients receive accurate, respectful communication while maintaining trust in their care team. Collaboration is another key strategy for expanding language access and strengthening your interpreter network. Building partnerships with community-based organizations and traditional health workers can help your organization connect with interpreters and increase access to credentialed professionals in your area. Here are a few ways to build effective partnerships. Collaborate with local organizations and traditional health workers to identify interpreters and share language access resources. Support community programs that train and credential new interpreters, helping expand Oregon's interpreter workforce over time. This concludes the module focused on Chapter 3. In summary, Chapter 3 provides a roadmap for integrating interpreter services into everyday care. By following the outlined steps, documenting good faith efforts, and investing in staff and systems, healthcare organizations can ensure that every patient, regardless of language, receives clear, safe, and equitable communication. In Chapter 4, we'll explore the Oregon Healthcare Interpreter Central Registry, how it works, what information it provides, and why it's an essential resource for providers.